Hello everybody, my name is Veronika Purrer and I am working as a resident in the neurological department of the University Hospital in Bonn. In this presentation, I want to cover with you the possibility of quantitative and qualitative tremor measurements after MRI-guided focused ultrasound in patients with essential tremor. I have no disclosures. The University Hospital in Bonn was the first German center using the ex-Applet neural system for treatment of medication-refractory tremor syndromes. Since 2018, we treated 63 patients with essential tremor, 29 with Parkinson's tremor, and one patient with a spinocerebellar ataxia type 12 with unilateral Thalamotomy. In 2020, we started to measure the tremor outcome not only clinically but also quantitatively. Herein, I want to present you the first data of 17 ET patients after MRI-guided focused ultrasound treatment. Qualitative and quantitative tremor evaluation was conducted prior as well as a few days and 12 months after the treatment. tcMRgFUS treatment was performed following the established treatment protocol using standard stereotactic coordinates as well as tractography of the cerebellothalamic tract. On the right, you can see the demographic characteristics of the patients who had a long-standing medication-refractory tremor. The common clinical rating scale for tremor, which consists of 3 parts, was obtained by a specialist in movement disorders. Part A includes the clinical rating of different body parts, Part B, several motor tasks, and Part C, a subjective disability rating. For quantitative evaluation, we used a triaxial accelerometer, the Somnowatch, which was placed on each side on the proximal 1/3 of the metacarpus. Tremor recordings were obtained bilaterally in rest and forward outstretched postural condition without and with weight loading, each for 30 seconds, as well as a kinetic movement for 15 seconds. After pre-processing of the data, fast Fourier transform analysis was used to determine the normalized power distribution of the tremor in a frequency band of 0.9 Hz to 15 Hz. In A, you see a sample of trimmed series from a single accelerometer axis for a patient with essential tremor while postural hold. The Welch periodogram of these recordings gives the tremor peak power in milligravity squared and some energy visible at harmonic frequency of the peak. A standard spectral analysis displays the time frequency power spectra in all 8 conditions prior and after the treatment. As you can see here, the power spectra decreases after MRI-guided focused ultrasound treatment in the treated extremity. Furthermore, we extracted a center frequency as the mean value of the area below the power spectrum and the tremor intensity as the root mean square of acceleration. The distribution of the tremor frequencies of the most affected hand is shown here and ranged from 2 to 8 Hz. The clinical rating scale for tremor and the tremor intensity measured by accelerometry both indicate a significant tremor reduction after MRI-guided focused ultrasound in the treated extremity, while no changes were found in the untreated extremity. At baseline, tremor was worse during postural and kinetic condition and symmetric. Both the clinical as well as the accelerometric measurements revealed a significant tremor outcome after 12 months. As expected, there were no changes in the untreated extremity. The congruence between tremor estimates on the clinical rating scale for tremor and the tremor intensity measured by accelerometry were relatively high in the postural and kinetic condition of the treated extremity prior and the untreated extremity prior and post-treatment. After treatment, no significant correlations were found in the treated extremity, probably because of the very low expression of the tremor. To our knowledge, this was the first time using quantitative measurements to evaluate the tremor after MRI-guided focused ultrasound. We were able to demonstrate a high correlation with the clinical rating scale. Previous reports found fair to poor inter-rater reliability for the clinical rating scale for tremor. Consequently, sensitivity leaves room for improvement and investigator bias can cause problems. Therefore, we think that wearables can provide a fast and feasible quantitative recording of tremor outcome. More investigator-independent methods may furthermore help to better characterize and compare the outcomes for the various treatment options available in movement disorders. Thanks for your attention.